This brings us to the second panel discussion of the day on elements to create a more consumer-focused, holistic, and value-based model of care. I'd like to introduce our eminent members, starting with our respected moderator, Dr. Mohamed Hamad, Head of Program, Quality and Monitoring Unit, International Federation of Red Cross and Red Crescent, MENA, which is Middle East, North Africa. Dr. Syed Sajid Ahmed, Head of Quality Management, Aspetar, Orthopaedic and Sports Medicine Hospital. Abdullah Ali Ngala, Executive Director of Nursing Services Administration, King Fahad Specialist Hospital, Dammam. Khaled Alsulame, Director of Patient Care Services, Ministry of National Guard Health Affairs, Kingdom of Saudi Arabia. Dr. Mohamed Nabil Taha, Co-founder and CEO, Alrazy Group for Healthcare Services. Cumai Aboul Housn, Co-founder, Binel IO. Abdurrahman Al-Masnid, Health Economics Lead, Ministry of Health KSA. And over to you, Dr. Mohamed, to moderate this wonderful panel.
Thank you, Satish. Thank you all. Let me just, before I start, I would like to thank the Kingdom of Saudi Arabia for having us here. It's both an honor and a privilege to me to be among those very diverse group of distinguished speakers. So I'm really honored and privileged. Let me also thank the organizers, the sponsors of the summit. I think it's essential for us all to, between there and every blue moon, we have to convene, learn from each other, build on others' experiences. I'm sure that we're all, as speakers, will learn something new today from each one of us. But also the participants with their questions, and we invite participants to share with us their thoughts when we start talking about the consumer-focused, holistic, and value-based model of care. So that takes us to the topic today. So let me share a little story before we start with the distinguished panelists and speakers. So as a child, I used to love mathematics. So to me, whenever I can translate anything into an equation to understand, to make it more comprehensible to me to understand, I do that. That comes with value. The word value is simply in our world, in the healthcare world, it's simply the outcome over the cost. So the denominator here is the outcome, and the denominator is the cost. So whenever we want to increase the value, we increase the outcome, whatever the outcome is. Is it an output related, an outcome related? So short term, long term. Is it a patient safety focused approach? Is it maybe an integration of the person after he's exposed to an intervention, a surgical intervention in a specific hospital? So all of these are considered outcomes and outputs. Over the cost, we're trying to, as much as possible, to be more efficient in a world now that is very, very challenged, especially after COVID, which taught us a lot about healthcare and healthcare industries and the use of telemedicine, right? We know now that healthcare is not about just healthcare. It's about economy, it's about politics, it's about education, it's about a lot of other stuff. So for us to, or for you guys to online to benefit of our distinguished members and speakers today, we'll have a question asked for each one of the 6 speakers today, and we'll hopefully by the end of the session we'll come to a conclusion of a little bit more understanding and make and leverage the presence of the speakers today with us. So to kick it off, Dr. Sajid Ahmed Syed, let's hear more about what are the benefits of value-based.
I think you're cutting off.
And is it the answer to, I'm sorry, am I back?
Yeah, you're back.
Yeah, just to kick it off with Dr. Sajid Ahmed Syed. So what are the benefits of value-based healthcare? And is it the answer to sustainability in healthcare? Dr. Sajid, the floor is yours.
Thank you so much, Dr. Mohamed, for setting the stage and that introduction. I totally attest to that equation that you brought into the picture, value-based care equal to outcomes divided by cost. And I think this is where the concept of value-based care originated from. How do we improve quality and outcomes for patients and reduce the cost? And with that concept in mind, the healthcare system is trying to make healthcare more proactive than reactive. And again, the emphasis is on positive patient outcomes and reduce costs. So in terms of ensuring positive outcomes, how do you do that? You need to focus on wellness, you need to focus on quality of care, and also invest in preventative health. And it is a transition because we have lived in this fee-for-service system for so long now that we need to actually transition to a system of fee-for-value. And this, I think, is the heart of the value-based care ecosystem. So talking about the benefits, I think the benefits occur for all the stakeholders when it is implemented in an efficient manner. So if you look at patients, it lowers the cost for them in terms of premiums and so on, and results in better outcomes because they have access to a functional, seamless, coordinated healthcare system. From a provider perspective, they have higher patient satisfaction rates and better care efficiencies. From the payer perspective, they have stronger cost controls because they know what the costs are, beforehand, and it reduces the risk for them because some of that is shared across the system. For suppliers, they can align their prices with patient outcomes. And for the society, this will result in decreased healthcare spending and better overall health results. So now we talked about outcomes for quite a long time now. So how do you measure these outcomes? This is the critical factor. What are the dimensions that you use to measure these outcomes so that it is objective across the system? So one of the most common models that is used to measure outcomes from a performance management perspective is the STEEP framework, which stands for safety, timeliness, efficiency, effectiveness, equitable, and patient focus. So those are the 6 key factors that we need to understand and keep in mind while developing this system. I'm sure a few of my colleagues will elaborate on this as we go through the presentation and the panel discussion. So those are the kind of fundamental pillars when it comes to assessment of the framework. And there are many indicators that are linked to these 6 pillars, should I say, including reduced readmission rates, enforcing standardization strategies, so on and so forth. I'm sure my colleagues will pick on that, and if not, I can come back and lay some light on that. In terms of your second question on sustainability, in value-based care models, we find that there might be short-term financial hits because there are increased costs when you are implementing the system. For example, you are moving the focus from acute and therapeutic care to preventative care. So that requires some investment also in terms of population health. However, the transition from fee-for-service to a value-based care system has been embraced as the best model for lowering healthcare costs while increasing the quality of care and helping people lead healthier lives. So we can comfortably say that value-based care is can largely be considered as an effective blueprint for promoting sustainable management approaches in healthcare. I hope I have answered your question, Dr. Mohamed.
Yes, thank you, Dr. Sajid, and thank you for sticking to the time frame of 5 minutes. Thank you so much. I think it's enlightening to see how simply what are the main benefits, and I like that what you've done here. So what are the main benefits for the community at large? What are the main benefits for the healthcare providers and services? But what are also the benefits for the patients? I like this diversity and explaining the steep framework of efficiency, effectiveness, time limits, and equitable. I think that's really, really essential. And thank you also for addressing sustainability and how could the value-based healthcare contributes to sustainability. But how can a value-based model be efficient? With us here today and to answer that question is Mr. Khaled Alsulame. Mr. Khaled, the floor is yours, sir.
Yes, thank you, Dr. Mohamed, and good morning, everyone. Actually, it's like because we are coming from the National Guard and hospital, and what we have trial, as Dr. Sajid may be mentioning, that's like we are looking for from the patient perspective and how to increase the patient satisfaction, how to increase the quality provided to the patient, and how to propose some solution that would be fit for the patient and will be feasible for the patient and also for the provider. And from this perspective, we're thinking maybe in different level. One of the level that since we are integrated our health information system to all region in Riyadh, Jeddah, Medina, in Eastern, these help the system is one best care system. It helps us actually to utilize the system in a nice way. Is not only the system, is even the service. So for example, in Riyadh, we have liver center. And in West, we don't have that liver center. Then we send our patient, maybe part of our population, maybe sent to Riyadh to utilize of these services. The another things, that's a level of the centers and how can utilize the center and how can we improve our services to our patient, and at the same time to increase our quality, at the same time to save budget and save cost. The another thing, for example, that's like when in Corona time, we are applying the telehealth process. We noticed that the telehealth process is helping our patient to communicate with them, to follow up with them, to even write them prescription with coordination with the pharmacy, we send their medication refill. All this system is not helping only the patient and even the provider, is also help the society and make our commitment to our society and the regulation by the health agency. The other things, not even now in this level, in the clinical, but also in the services level. What we have been done right now is we implement some propose an idea that we call we care system, is almost like call center in the banking, and we try the patient, if he asks for something, he doesn't need to come and ask for anything, or maybe requesting like medical report or anything from the hospital, or say for example refill pharmacy. That will help the patient to stay home, to stay safe, to help our society, to reduce the cost, to make him feel happy, and increasing our living of standard for the patient. At the same time, we'll make it easy for our provider and our team member to work in this achieving these goals. And not even in this level also, that's, we call it, this is hospital, maybe standard of we live in for the hospital level. Now we are thinking about how to moving the patient from ward to ward, we put it in the system. Now we are understanding how many patients need to be transferred every day, and even not even this, but actually how many patients will be carried by each patient escort. And this is concept value-based model. We apply it in all level of the organization. We are looking for more to applying more in another services. And thank you so much, Dr. Mohamed and our team member in this opportunity to share with you our experience.
Thank you, Mr. Khaled. I think that sharing your experience is an eye-opener. Although, of course, we wish we had enough time for you to actually share more information about the We Care system that you established. And thank you for sticking to the time. And I like that both speakers up till now, Dr. Sajid and Mr. Khaled, has addressed a very patient-focused, but not just the patient. They talked about the community involvement and how we engage communities and what's the greater good and the greater benefit for the society that we're living in. I think it's extremely essential. So after that, we want to understand more about how a value-based, patient-centric model of care could contribute further to transformation. Almost every country that I've been privileged to work within, or every region, is always the healthcare is going into a transformational phase. Even the most developed countries, they want more. They want to increase the value, increase the quality, increase patient safety with less costs. So with us today is Mr. Abdullah Ali Ngala. He will talk about how to measure the efficiency of a value-based care and can a value-based model help or address the healthcare transformation. Mr. Abdullah, the floor is yours.
Assalamu alaikum, and thank you for having me in the panel. And I'm very happy to be with you today. I think what's going on now is something that will be positive for years to come, because we're used to volume-based care where organizations are paid based on the patient they've seen, to something which is volume-based. It's not just how many you've seen, but how many were able to stay healthy after you've seen them. So I think this is a positive move, but how do we measure the quality? This is, as Dr. Sajid mentioned, it has to be STEEP, which I'll talk about STEEP later on, but what I will say here is all about STEEP. So we have to measure it through how effective and efficient is it around giving the patient the right care the patient requests. So we have to have measurement on that. How do we measure that? That all comes from the patient. And I'm very happy with Saudi Arabia because it's one of the only countries that has something that a patient can just send a message to say whether I'm happy or not during the care or after the care. And how timely the care is, because I was in another healthcare system where there is a fee for service. Then you have accumulation of so many patients being seen at the same time to get the money. But at the end of the day, you have those patients coming back. Or you have the patient being booked, but they have a very long list or even months to be seen. So it's not timely a lot. This normally affects patients' satisfaction, it affects patient outcome, and at the end, the healthcare system suffers from it. The other that can be checked is how safe is it? Yes, I have been treated in the hospital. When am I coming back? Should they give me a treatment that I should not come back to the hospital again? Or I should just be coming to be seen, but not to be readmitted? What we are seeing now is in many healthcare systems, patient will be treated and within 2 weeks, they'll be back to the hospital. So because they've got secondary infection in the hospital, or because the system was just to push them out, to bring more in because of the quantity. So with value-based care, I'm sure the providers will make sure that the care they provide will be so efficient and sufficient for the patient, and at the end, it will be good for the outcome of the patient and the community at large. And then 3 reasons why value-based care works is because according to the system, it should be patient-focused. That is, patients want to feel like they are being listened to, and that their providers care about their own health and well-being. So patient-centered care checks off. These boxes will provide a more fulfilling experience for our patient for the future. The other thing is equitability, how equitable it is. Am I just receiving the care because I've got the money? Or can I still access the care even if I don't have the wealth that the other person has? Which is what's going on with the transformation. To have a system where everyone can access the care, can be supported to access the care through a support system which is manageable and which is being checked by the authorities. So I think with these 5 quality checks, that will surely ensure that value-based care is being given and is being checked from time to time. But what has it to do with the transformation? So Dr. Sajid mentioned STEEP, which it has to be safe, timely, effective, efficient, equitable, and patient-centered. So once we have that, this is the whole aim of transformation anywhere. How do we get that to work is another thing. We need to have a good electronic system. This is the HIS, like what they have in National Guard. I'm so grateful I have worked in the National Guard, so I know how they do their own business, which is excellent. So that has to be accessible, has to be everywhere. If you have different systems working in different areas across one department, it is not going to help it, it is not going to work. So culmination of all this, having this all working nicely and how it should be, that will lead us to what we're aiming for in the transformation, to have accountable care organizations. Organizations that spend money that should be spent, not just because spend money to be wasted without patient receiving the outcome in a proper way. Thank you very much.
Thank you, Mr. Abdullah. I think, thank you also for sticking to the time, less than 5 minutes. But amazingly, you brought up the discussion about it's not just that a patient is exposed or she or he needs a medical intervention, so she or he visits the hospital or the healthcare facility or the health services facility. It's about the outcome, right? Not the output. So it's not dealing with the patient to treat the patient now and then leave him at this stage. There is a lot to do between finishing his or her intervention with the healthcare provider and then what comes after. The aim of having a great outcome is extremely different, and it's extremely different, very different than having an output-oriented organization. So thank you for mentioning that. So let's narrow it down a little bit. So we have also Dr. Mohamed Nabil Taha is, we're gonna ask him a very specific question about telemedicine. How can the telemedicine help organizational culture to be more aligned with a consumer-focused and a value-based model of care? Dr. Mohamed, the floor is yours.
Assalamu alaikum. It's a pleasure and honor to be invited to this event, the KSA Telehealth Technology Summit, and to share our thoughts together with all these great experts and healthcare professions. Really, I am very happy with the theme of this event because it connects a lot of new concepts together. We all talked, we were talking about quality in healthcare for decades now. Now we are talking about quality in healthcare with another new concept, which is digitally enabled care. So the new concepts that are introduced to our traditional healthcare systems are continuously increasing. I'd like to mention that here in Cairo, Egypt, last March 2022, Ain Shams University usually arrange its Ain Shams University Medical Congress, which includes, it was the 42nd conference, which usually includes a lot of specialties talking together. And they did a very unique move when they merged two conferences together. We can guess which conference they merged together. They merged the fourth Arab African Telehealth Conference with the fifth Quality Conference. So I don't think it is a coincidence that we are talking quality in health, quality and in healthcare, and equality in telemedicine now. I was in the Egyptian conference last March, and now it is KSA with the same theme. And if we went to our session today, we are introducing another new concept, which is value-based model. Dr. Mohamed mentioned in our pre-session discussions the fast-paced world, and I think Dr. Mohamed that the healthcare world is moving faster and faster than we can all imagine, and it is a very great challenge for all healthcare systems and healthcare professions to cope with the new terms and new concepts and the new patients' needs. So I'd like to mention that now there are a lot of reports and a lot of studies that shows that there is a great and growing evidence that telehealth can achieve variety of benefits for a value-based care. And I am not going to repeat the value-based care concept as mentioned by the previous panelist. From these benefits that telehealth can help in the value-based model, for sure, is the expansion. It expand the access for healthcare, which is one of our great challenges for healthcare, and one that value-based model outcomes could be assessed is the access for healthcare. The other thing is for sure is the improvement of healthcare quality and healthcare outcomes. Comes third is the improvement, the cost reduction that telehealth can do for a value-based model healthcare. And finally, the patient satisfaction and patient engagement in telehealth, and we all observed how the patient interacted with telehealth apps and telehealth and telemedicine during the pandemic, which was a very successful story for telehealth. And from this last benefit, which is patient engagement and patient satisfaction, I think that healthcare systems and healthcare professions, and especially the patient-centric and the consumer-focused healthcare facilities should be focused on telehealth innovations, not just only as one of its tools to achieve a value-based model healthcare. No, because it is a patient-driven tool that we should work on and collaborate either national or regional basis to achieve more and more in the telehealth achievements. Thank you, Dr. Mohamed.
Thank you, Dr. Mohamed, and thank you for staying on time exactly. Yes, of course, patient-centric approaches can use a lot of telemedicine. Telemedicine sometimes is the waste of time that the patient encounters when he goes to a clinic or a hospital for a simple intervention or a simple consultation, be it a chronic disease, regular follow-up, or be it a skin disease, a rash that he has, and it could be easily done at a very convenient time, is extremely, it goes without saying that you're saving a lot of money, not just to the patient, but actually to the provider and also to the economy at large. There is a lot of also green implication and climate change issues related to that. Less transportation is being used, so it's a win-win for everyone around. Talking now about telemedicine is just a representation of information technology. Dr. Cumai, Aboul will address or will answer the question, could information technology functions play a really instrumental role in enabling a transformational journey towards a value-based model of care? Dr. Cumai, the floor is yours.
Thank you, Dr. Mohamed. First of all, I want to correct, I'm not a doctor. I don't have the privilege to be a doctor. Sorry.
It's completely fine. Completely fine, sir. Sorry.
Yeah. Thank you. And I really appreciate the opportunity to be here with this beautiful panel. We're learning a lot here. You know, when we talk about information technology, I think I should start with giving a loud shout out to the IT teams during the last 2 years. I think they did a lot, and they were not considered as frontliners. They are in the backstage. So they deserve a lot of appreciation. When we say value-based and when we see the equation of the value-based health delivery system, the core of it is customer centricity, or here it's patient centricity. And I think this is where we should focus when we deal with the information technology. The thing, when I look at the information technology departments or functions, we should start by defining who is our customer, and moving from that to see how we will deal with this customer. The customer of the information technology is not the patient, is not the community. Their direct customer is actually the medical staff, the physicians, the doctors, the nursing, and the administration. So it's mainly the people delivering the service to the end customer or the patient. And I think here where we have the main issue. There is a lot in every study you read, or you see always this big note that doctors hate their computers. And I think this is sometimes it's a joke in the social levels. People talk about it. I think this is where information technology should start. Building a vision that to change this common fact and move it from doctors hate their computers to a different state. I think this is where we can build a real mission statement for every information technology. And if we look at it, why this is happening, I think during the last 2-3 decades, since the healthcare start adopting technologies and health systems, what was considered as customer for the IT department is the management more than the doctors. So we want to satisfy the requirement of the administration. That's why we see a big improvement in billing and monitoring and all the administrative stuff. But on the other side, it's less, because this is what we consider as our customer. So I think shifting the customer to more toward the medical staff is crucial here. And you know, the healthcare is very complex model. If I will try to break it down to pieces, it's overwhelming. So I will take like a metaphor here, the airplane. Okay, the technical team behind the airplane, their main focus is the crew. Okay, the pilots and the crew members and the boarding staff. This is where they focus. For the technical team, they don't care about, or it's not their priority to know why every passenger is taking this plane. Someone is going home, someone is traveling away from his parents, and what emotions they have. All this, it's not what they need to deliver. Is a plane ready to fly safely with everything functioning as should be, and giving this confidence to the crew members so they can deliver the service, they can deal with people's emotions, they can deal with their passengers without worrying about other stuff. I think delivering this confidence is what we need to think of as an IT or information technology department. We need to move, as the colleagues said, mentioned many times about, this is a culture change. Moving to value-based is a culture change. So I think there's an opportunity for the information technology functions to lead the way in changing the culture, because they are a smaller team, they are less complicated, they are more like they have similar mindsets, so they can lead the way in changing the culture and be the spearhead in this movement. When they start moving from dodging to doing, like now when they receive any request, instead of rejecting, I can be more transparent with the doctors, or the medical staff, I can explain the reasons, and I can partner with these medical staff, maybe because most of the time the rejection is not because they don't want to do things, it's because of regulations. And regulation is always behind the progress. I think this is something we know. But the information technology team can be the drive force to put pressure to change regulations, because regulations are not there to stay as is. It should evolve moving forward. So especially with the rapid change in the information technology front. So taking this partnership with the doctors, with the medical team, I think this can happen in two ways: top to bottom and bottom up. CIOs and IT executives should socialize more with doctors. You don't see these teams in any events for the medical staff. No, they need to be integrated more in the team. They need to engage more, understand their customers more, building this knowledge, and start investing more in making the life of these guys much happier, make them love their computers, and then the patient will be happy. Yeah. Thank you.
Thank you, Mr. Cumai. I think that we all agree information technology is a game changer, and it has to be a game changer. The use of technology could be a cost saving, a patient satisfaction focused. And I do agree that we have to identify our customers at the end of the day. Sometimes when I talk to a leader or manager and he tells me that my customer is my priority, I have my doubt, because her or his priority should be the employees that actually give or make the services. So I agree completely on identifying who is your customer. So talking of COVID-19 at the beginning of the session and how it changed the world, and it did of course have a lot of negative impacts all around the world. People lost their lives, people were affected, their quality of life were affected. But there are light at the end of the tunnel. We learned a lot of things from COVID-19, not just on a national or regional scale, and on a global scale. So Mr. Abdurrahman Al-Masnad will talk us through how or could, after COVID-19 impacted our economy in many ways, what would be the global and national reflections? What are the global and national reflections in the Kingdom of Saudi Arabia while the kingdom is moving towards a value-based model in healthcare? Mr. Abdurrahman, the floor is yours.
Thank you, Dr. Mohammed, and thank you all for your thoughts. I really enjoyed it, and it was really insightful to have all these thoughts and reflections about the value-based healthcare. And before I zoom in on the question, let's talk about the advancement in the Saudi digital economy. We had interesting years since the inception of Vision 2030, 5 to 6 years ago. In the past 2 years, Saudi health sector have leveraged multiple opportunities to facilitate the adoption. When I mean the adoption of information technology by patients and providers, and it was really interesting. In a matter of weeks, millions have downloaded Sahati and Tawakkalna. MOH introduced the biggest virtual hospital. Private insurers and providers have collaborated in delivering telehealth and COVID testing solutions. To answer your question, Dr. Mohammed, I would like to note that globally, the top 5 reasons for poverty is directly related to social determinant of health. And according to the World Economic Forum, there are 500 million people are at risk of falling into poverty due to healthcare costs, which impacts all domains in a wider spectrum. And to state the global problem in healthcare, we pay too much for an unpredicted outcome. Pre-pandemic, we always have said, we will change. We must change. I want to make the point, in the post-pandemic era, we will change. Our leader, His Royal Highness Crown Prince Mohammed bin Salman, has decided through his vision to transform how healthcare is provided by moving from a reactive to a more proactive payment model, which bring a tangible outcome to payers, providers, patients, and Saudi as a whole. And by doing that, it's going to change how physicians practice. They are going to come up with ways of being able to take care of their population of patients in a better way, higher quality, more convenient, rapid access, lower cost. I think that will challenge us, but I also believe putting the patient at the front will incline our chances in restoring purpose and mission. And I expect some doctors will step forward. And when they do so, others will follow. In our 2-year journey, during the pandemic, we have learned how the investment in high-functioning comprehensive EHR, patient-centered medical homes, empowering primary care physicians, multidisciplinary teams, and process and measurement tools can drive a sufficient return on investment in a physician-led culture. In healthcare, there isn't any higher return than maximizing quality of care and saving lives. When physicians have comprehensive information, not just primary care, but every doctor can look at things like instant HbA1c or hypertension and be able to communicate, not necessarily treat it, but the acknowledgement itself can be life-saving. However, we have learned with digital transformation, we can unlock growth and scale. And I cannot stress enough how important to choose the most sustainable and optimal technologies that serve the physicians and patient needs. An example, in the Ministry of Health, we have investment heavily in the development of Taha Virtual Hospital, which is not only providing the most specialized doctors to treat critical and high-risk patients, they are also teaching and transferring knowledge to other doctors working in rural areas. Telehealth drives so much value when designed properly. We have learned through the pandemic that understanding the needs of our population, investing in caring culture, and eliminating waste is key for high-value care. Last week, the Eastern Health Cluster has published a story that they have increased their dental clinic capacity to fulfill the cluster population needs. Another example is a private hospital in Jeddah. They included patient-reported outcomes and experience to design personalized care experience. And all that is driven by caring culture and population needs. We have learned that investing in medical education and clinical leadership and caring culture can make us thrive. And don't get me wrong, doctors are very caring. They are very dedicated and very hardworking. What is uncaring is the culture. A culture is the norms and values that drive physicians for innovation, clinical leadership, preventing and managing chronic diseases, providing high quality care, compassionate care, and uncoded empathy. In this massive transformation, we are creating a culture that elevates primary care, a culture that values prevention over intervention, a culture that understands the urgency of value-based healthcare. I hope I got it on time.
Yes, exactly on time. Thank you, Mr. Abdulrahman, and thank you for the passionate speaking. I get a lot of energy of your attitude while you talk. I hear a lot of genuine thoughts. The social determinants of health, how important is that? It's not about just health. We know that. We know that long time ago, but how much our countries and the globe is investing time in social determinants of health to guarantee that we have a healthy, well-being people living on this planet. The importance of education and how we utilize technology and telemedicine and tele-education in that. The culture, which I'm passionate about, how to change the culture, not just on an organizational level, but in something as huge as ministries of health within the kingdom or within Egypt or within any country. That's a huge, huge investment. And there is a scientific way, fortunately enough, to do it. I would love to thank you all. This was a very privilege and honor for me to facilitate such a distinguished panel of speakers. As I said before, I learned something from each and single one of you today. And unfortunately, I don't think we have enough time for questions, and I don't see any questions that are posted in Hobilo to be addressed. So by that, thank you, the Kingdom of Saudi Arabia. Thank you, sponsors, organizers. Thank you, all distinguished speakers. It's been a privilege. Thank you for those who are tuning in online. Satish, over to you.
Thank you, Dr. Mohamed. Definitely, it was a wonderful panel. I would like to thank all our panelists, Dr. Syed Sajid Ahmed, Mr. Abdullah Ali Ngala, Mr. Khaled Alsulame, Dr. Muhammad Nabil Taha, Mr. Cumai Aboul Housn, sorry for mispronouncing your name before, Mr. Abdul Rahman Al-Misnid, and our dear panel moderator, Dr. Mohamed Hamad, for an extremely interactive and insightful discussion. It is indeed great to hear about the elements to create a more consumer-focused, holistic, and value-based model of care. Thanks once again, and have a lovely day. We have a short video now from one of our sponsors.
Thank you all.
Health, the beating heart of your everyday. It's in every step of your journey, but no matter where your journey takes you, we are there with you. We collaborate with scientists, researchers, and hospitals to support doctors, surgeons, nurses, and caregivers across the world to give you the best possible solutions to improve your health. Innovation and you, Philips.